Namaste, friends. I welcome you on this platform of the Spiritual Doctors for Holistic Health. Some of you might be aware that in mainstream medical system, there is preconceived notion that for some disease, there is no cure. But there are few medical doctors, few observations are there that there is something called spontaneous remission. And some work are going on this topic by different professionals like Dr. Bernie Siegel, Kelly Turner, and today we have Dr. JeffreyRediger, and he is an assistant professor at Harvard Medical School, and he has written a wonderful book. The name is Cured. And in my personal observation, I have observed case of a spontaneous remission in case of colorectal carcinoma and quad equina syndrome. But the mainstream medical science, our medical fraternity, doesn't accept this concept very much, and we have tendency to ignore whenever we got some finding. Doctors, although I have read the story of Dr. Jeffrey, but today because most of our audience are not familiar with this book and his work, he has spent 12 years on this topic before writing the book. And so how you got into this mindset that I need to explore? We would like to know that first, and then how you would like to proceed, Dr. Jeffrey. The platform is yours. So, welcome in Indian tradition. Namaste.
Well, thank you for having me. I feel so honored to be here with all of you. It's been a long personal and professional journey for me. And honestly, I went to seminary at Princeton before medical school and became convinced there that the East needs the West and the West needs the East. And I know that training as a scientist and a physician has been really important to me, but it's been really important for me to help others and myself continue to study and understand the wisdom from the East. And that has informed a lot of my own personal journey. So I appreciate your efforts in holistic efforts to bring people and patients the kind of care they need. We need both science and wisdom for sure. So let me tell you first how this all came about for me. After I graduated from residency, I was a new young psychiatrist at Harvard and a new young medical director, and a nurse from the oncology unit at Mass General Hospital in Boston came to me and said that she had been diagnosed with pancreatic cancer and she wanted help explaining this to her son. This was something I did with her and her son, but then she took off for a healing center in Brazil and she came back saying that she had been undergoing a deep healing of her beliefs about her value as a human being, and her factors associated with her cancer were improving. She was starting to eat steak and salad again, and she was shedding all of these false beliefs very actively. And she wanted me to look into it since I was a physician and also had this training from seminary. I declined because I didn't think there was anything really going on that couldn't be explained by medicine. But I owe a lot to Nikki. She began asking people to send me their medical files from around the country and elsewhere, and people wanted to tell me their stories about their healings. And I continued to resist for a while, but over time I began to look at these medical files, and even though most of them could be explained through some kind of backwards backdoor thinking that we often use in medicine, some of them couldn't. And so the long and short of it is I did begin eventually to look into these cases. And it has changed me at every level, both personally and professionally, to begin looking at these cases of people who have such have medical evidence of such amazing recoveries. Now, I grew up in a very violent and conservative Christian home. It was actually very fundamentalist. My father was Amish. And so I grew up without TV, radio, dancing, didn't have access to a lot of social events and that sort of thing. So I had a lot of questions, and I was a very confused and angry young man when I went to college. And so I started really struggling to understand the role of different disciplines and to really study healing at its deepest levels. And so that carried me through my earlier studies and then seminary and medical school and residency. But then Nikki helped me begin thinking about all of this in a new part of my personal journey in 2003. So in 2003, I did actively begin studying these individuals. I began collecting medical evidence, and I had 3 criteria that every person I studied needed to fulfill before I would go deep into their lives and medical history. So number 1, the person had to have a genuinely incurable illness, according to all that we understand. Number 2, they had to have medically indisputable evidence for accurate diagnosis and clear evidence for recovery. And number 3, there needed to be no complicating factors, such as an experimental medication or anything else that could potentially explain how they got better from a traditional medical standpoint. So this was a study that took a lot of time, because to consult with the specialist for each illness and really make sure that I was understanding the natural history of this illness, to speak with family members, to go deep into the life of the individual. It was a blend of both quantitative biomedical labs and material, and also a qualitative study going deep into their lives. And I think that blend was very illuminating. So, what did I learn? I learned a lot. In science, we call these cases spontaneous remission. And in medical school, I was taught that these cases have no medical or scientific value, that they are just flukes. If we are on the religious or spiritual side, we call these miracles or spiritual healing. I think what's true is that all of these terms are black boxes that are explaining something similar, but they've not been opened up and examined by science. What I learned along the way is that there's nothing spontaneous about spontaneous remission. And I also learned a lot about the biases that we bring to science. In this use of the word spontaneous, it means without cause. Spontaneous means without cause. Can you imagine a less scientific way of thinking than to just assume that these cases have no cause? That's actually not logical, because everything has a cause. And so along the way, it's helped me begin remodeling the way I think about science. And we need a more rigorous science. And there's a lot that can be said about this. We could have a whole talk just on what it means to go deep into this area. And for example, study the ultimate performers in health and well-being. These are the ones that get screened out in a lot of our data when we just look at averages. It's certainly true that if I was ill, I would want to know what the average person does. But I would also want to know what these Olympians of health and well-being are doing, because they're doing things really differently in the same way that an ultimate performer in sports is doing things really differently than the weekend warrior. I've learned that there's a lot of physical in the mental and a lot of mental in the physical. In fact, I don't like to talk about mind or body. I prefer to talk about nervous system dysregulation and what it means to heal that, because that is a way to not fall into the mind-body chasm, the deep dualism that separates mind from body in a way that we don't see how they go together. So when I try to stick to talking about the nervous system dysregulation and the chronic inflammation and the relationship of stress and all these other factors of health and well-being, it's a way to do so in a way that's much more unified. And all of this has a huge amount of relevance for the 85 to 90% of illnesses that every day in my world we treat as incurable, but in fact are lifestyle related, whether we're talking about the major killers like diabetes, heart disease, cancer, lung disease, autoimmune illness, or many others. So there's a lot to be discussed here. I know all of you have gone deep into your study of so many factors associated with health and well-being already, nutrition and stress reduction and others. And so in the brief time that I have with you, let me just talk a bit about the four pillars of healing and well-being that I have studied. The one that I believe is most important is the healing of our identity. And this is the fourth pillar that I write about in Cured. This is in my interviews with people, this is where they would sit up, a light would come in their eyes, and they would say, this is why I'm so grateful for this illness, for what it brought to me, because I have such a different quality of life and such a different understanding of myself as a human being and the world we live in now because of this. And this is what I've called the pillar of healing our identity, healing our false beliefs, coming to a deeper understanding, not just cognitively, but experientially of what our value is as human beings, and to be able to eliminate and sharply turn down the volume of the false beliefs that we've acquired along the ways. We all grow up in our families and in a world where we pick up the beliefs of those around us, at home, on the playground, from friends, from teachers, later from bosses. And some of these beliefs are true and some of these beliefs are false. And it's my belief that if we are carrying around a set of beliefs, some of which are true and some of which are false, that we are going to have mixed results in our bodies, in our minds, in our central nervous systems, and in our lives, and in our relationships. And so it's just been really a privilege for me to listen to these people talk and describe the ways in which their lives have changed because of healing their identities. This is the most difficult pillar to talk about, but it's the most important. When I published Cured, my publisher said one reason why he believes in this book, he said that 40 books will be written about nutrition this year, but he said no one's ever written about what it means to heal your identity and the effect that this can have on the physical body. And he said that's why he believes in this book and why he believes it will be around for a long time. I think that I don't pretend to have captured it in the best way. I think that as we do this research, our understanding of this area will deepen and we will be able to figure out more details with it. But it's been so meaningful to me to begin mapping this area and seeing how important it is in people's lives. So there's a lot that can be said about that. Beliefs. We have a hard time knowing how to think about this because it's not true that we can think ourselves into health. It doesn't work that way. But it is true that we all have a complex set of beliefs, some of which are conscious, some of which are unconscious or subconscious. And if we can begin finding ways to heal these so that we can experience the full dignity and value of who we are and the full dignity and value of each other, and connect with that and eliminate the barriers to our attachment to our authentic self and to those around us, it can be really life-changing. So, and this also connects with a lot of the placebo research. It's been mentioned to me about the arthroscopy study that I mentioned in Cured, and you know, in the United States, arthroscopy surgeries are performed at a level of millions of dollars every year. And yet a very well done study published in the New England Journal of Medicine a number of years ago found that that when people have a incision on the knee that and think they had the surgery, the results are equally as good as those who actually had the surgery. And a cut that's a little bit bigger on the knee is even more effective than a small cut on the knee. So there's all these things around placebo and belief. I think the truth is we all have capacities in our minds and hearts that we need help learning how to activate. And so I want to leave time for a Q&A. I just simply want to say again how grateful I am for those who've been studying these through Eastern wisdom for a very long time. There's a lot to be gained there, and it's certainly enriching my life and the way I think as I've approached this research.
Yeah. For those who are new, Dr. Jeff has mentioned 4 pillars of. I will just revise the 4 pillars because some of you might not be catching this topic. 4 pillar is one pillar is our food, lifestyle. Second pillar is our mindset. Third pillar is our community, and the fourth pillar is a sense of identity, meaning and purpose of life, and something called spirituality, which is our common factor. But Dr. Jeff, I want to know how to integrate. It is a black box for medical fraternity, but how to start the studying this phenomena that which you are mentioning, that sense of identity, which is the chapter number 9 in your book, the part 2.
Yes. How to start studying this, would you say?
Yeah.
Yeah, I think a lot of it comes from our own personal practice and beginning to integrate that into our lives and not separating it off. I have come to believe that patients are so hungry for talking to a physician about more than just their illness. They want to be understood as human beings. They want to be understood in the context of their own personal struggles. And it doesn't have to take a long time. As physicians, we are taught to set aside the story of the patient in order to penetrate through to the underlying signs and symptoms so that we can make the right diagnosis. It's my belief and experience that we can still get the story of the patient and begin with that. By what I often will do is sit down at the bedside and just ask, so what's been stressful lately? And that often prompts an outpouring of stress. And then I can begin to ask questions and get a sense for, well, is there any relationship maybe of this illness to stress or to what you're experiencing or to your deeper struggles in life and your beliefs? And there's often an outpouring around that as people begin to make their connections and let themselves know what they already kind of know, but they have not given themselves permission to know. And it helps to have a doctor give permission to know. So that's been very rewarding for me, but it doesn't have to take a long time. I can ask the questions about signs and symptoms along the way and still get what I need there to make an accurate diagnosis, but also get the story. And I just find that to be something that also prevents burnout for me because it's so much more meaningful. And it's something that patients love a lot. And so that's my personal approach. That's part of what's been really useful to me.
In the author's note section, you have mentioned work which are similar to your work. Dr. Bernie Siegel's Love, Medicine and Miracle. Louise Hay, Heal Your Body. Kenneth Pelletier, Mind as Healer. So, to elaborate the role of mindset, how you have included these books in your note.
Yeah, they're wonderful books. I also recommend Lissa Rankin's Mind Over Medicine and Kelly Turner's book. Also, she's written a couple of books. And Lissa Rankin, my partner, actually has written books about this as well. there's actually quite a few books around all of this that are starting to come out in the last decade or so. And Bernie Siegel wrote his book decades ago and took a lot more flack than I did, frankly. And so the world is opening up and changing slowly, which is great. But those are great places to start as well.
So world is changing. So what to do to change this world even with the faster rate? What you recommend
What's that?
to change this world with the faster pace?
Yeah. Well, I think we just have to let ourselves be open. I mean, it's so fascinating to me how little curiosity that is among traditional allopathic physicians. I have a very good friend, Jill Bolte Taylor. She gave the first TED Talk that went viral, and she was a young postdoc at my hospital at Harvard when she had a stroke at age 37 that took out much of her left brain. And when we met, she said, "Doc, I've been waiting for you for 22 years." She said, "In 22 years, not a single doctor has ever had any interest in how I fully recovered from my stroke." And this is in spite of the fact that she's a neuroanatomist. She's got a book in 30 languages that's been a perennial bestseller for many years about her stroke recovery. She gave the first TED Talk that went viral, so it's been viewed millions and millions of times. She was named by Time Magazine as one of the most important people of 2008, and Oprah was doing a movie on her life until she pulled out, until Jill pulled out. And so in spite of all of this, doctors have never been interested in what she did. And that's consistent with everybody that I interviewed for all these years since 2003, that people would tell me that their doctors weren't curious about how they got better. And I think what's great about our medical training is it turns on parts of our brain in a way that's brilliant and really important and useful. But it also turns off other parts of our brain because there's so much knowledge to amass. And so we get socialized into a very powerful method, but it leaves in some parts of reality and shuts us off to other parts of reality. And I think if we can just let ourselves be curious a little bit. I remember when a person went into an MRI machine at the hospital where I was the chief of behavioral medicine, and went into the MRI machine with multiple myeloma, and then had this amazing spiritual experience in the MRI machine and came out, and they then canceled surgery the next day because the tumor had shrunk so much. And so it's a long story there. I don't have time to go into, but we've had other experiences like that with MRI machines at McLean Hospital, where we actually have a physicist who is trying to understand the ways, what happens when a person goes into a MRI machine with bipolar disorder, for example, and then comes out and their bipolar mood has very different and stabilized. It doesn't happen very often, but it does happen occasionally. And so even though it's rare, they're trying to figure out what happens to that those factors come together in the MRI machine that things get better quickly for a person. And I think that's a long discussion, but again, we as scientists, we have a responsibility to ask good questions, to rekindle our curiosity, and to simply open ourselves up with good questions to trying to understand what's going on. Because the truth is, the world is much more mysterious. The human body is much more mysterious than our paradigms often allow us to see. So let's not be too confined by our paradigms and let's try to be open.
So I want a recommendation from you for general people as a patient, how to start this recovery process, and recommendation for those physicians who are attending our this webinar today. So what you will recommend to pursue the all four pillars of this spontaneous healing?
Yeah, I think every one of us can enter into that healing pathway from a place that makes sense to us. Different people will start at different places and then branch out to different pillars or different parts of healing and well-being. But we all have our own unique journey that we're on. For me personally, it began as I was studying these people. I first became interested in their nutrition, and they transformed my understanding of nutrition. But then, and that helped me begin rebuilding my own body and nervous system. And it was then later that I began to deepen in my approach and my questions and understanding of things. So some people will start with the healing of identity, and that just starts to pour so much vitality and life into the body that it gives motivation for the examining and changing our lives in other ways. And some of us will start with things like nutrition or stress reduction or rest or other or addressing issues in our relationships or forgiveness. So I think every one of us has a different place that we might start in that pathway, and then branch out from there into other areas that become meaningful at a later point in time.
You have mentioned nervous system dysregulation is one of the cause of disease. So
Yeah.
can you shed more light on this topic?
Yeah, I think the body really does keep the score. If anyone's interested in going more deeply into this, there's a great TED Talk by Nadine Burke Harris that's been viewed millions of times. She was the former Surgeon General in California, and she gave a brilliant talk on the adverse childhood experiences research. And I don't know if that's a familiar term. The adverse childhood experiences research should be transforming medicine, and has massive implications for how we think about health and well-being and the curing and healing of disease. And I can go as deep into that as you would like. It's basically looks at the ways in which different kinds of childhood stressors and abuse affect the adult body as the child becomes the adult and grows up. And that's a dose-response relationship. If you type into Google adverse childhood experiences, you can take it takes like 1 minute to take the test. It's just 10 questions, and you take the test and just see what your score is. This is not research that is to be doubted. This is indubitable. This is proven research with thousands of studies that's been occurring over the last 3 decades and has established such a strong foundation showing a dose-response relationship to the amount of stress a child experiences and what then happens in the adult body. And it goes far beyond self-destructive things like addiction or other things. It goes deep into showing the ways in which we do carry stress in our bodies and what it means to begin healing the nervous system around these, because the nervous system is the link between our minds and our bodies and results in if you are if we marinate our beautiful immune cells in the stress hormones of cortisol and norepinephrine and other stress hormones every day, that's a very different environment for your beautiful immune cells and all those highly specialized parts. And we know on the basis of both clinical and laboratory evidence that if those cells are being affected by these stress hormones day in and day out, we know that those cells begin to make mistakes. They become sluggish. They begin to attack the body that they are sworn to protect instead of attacking the pathogen or the mutating cell that needs to be eliminated. We know that this has a huge impact on the rapidly escalating number of autoimmune diseases that are occurring around the world. And so whether we are looking at these factors of nutrition and poor quality food from below, for example, or chemicals in the environment, or looking at these issues from above with the amount of stress that the person is under, and how they are related to the stress and the traumas that their body carries. By looking at the nervous system as the connecting point between mind and body, we can understand much better the ways in which chronic inflammation can be caused from below or from above. We now know that chronic inflammation is the common pathway that creates disease. Whether we're talking about diabetes or heart disease, it used to be that we would look at each disease through the body organ. And there's all kinds of reasons why we did that. But now we know, when we step back and look at the forest instead of just the trees, we now know that underneath illness, there's this pathway of chronic inflammation and affects multiple body parts and has to do with both the mind and the body and the nervous system. So there's a lot that we could talk about with that.
Yeah, PTSD has become more popular than the concept of trauma stored in the body. But yes, we need to identify and we need to deal with it.
Yes. Yes, we sure do. And there's so much that we can do beyond just prescribing a medication, for example. The medication can help, but there's so much more that we can do to heal the cause of what's going on.
So there are many questions in the chat, but first I want to mention your thought on the third pillar, that community living, that practicing love in the life.
Yep. Yeah. I think we all long for connection with others. And one of the biggest causes or contributors to illness and disease is the loneliness that people live with. And it's such an important area. Loneliness has been named, I believe, by the World Health Organization as one of the most important health issues facing our world today. And we need ways to reach out and connect with each other. And if we had more time to talk about, we would talk about the ways in which the vagus nerve, when we activate that with authentic connection with others, when our eyes light up, when we are connecting with somebody, whether it's someone we talk on the street with 1 minute for 1 minute or a loved one, that this can activate our vagus nerve in a way that is also protective and has its own healing effect by the secretion of dopamine and oxytocin and serotonin and these chemicals that our cells badly need.
So happiness hormones and love hormone, oxytocin.
Yeah, right. Yes.
This topic also ignored a bit. Yeah. So there are many questions. I will like to ask the good questions among the chat. Like you have mentioned that the role of spirituality or divinity. So what do you feel the role of meditation play in the healing?
That's a great question. There's many types of meditation. I think that there's no one simple answer for that, because there's many types of meditation, and there's also different ways that each person will tend to apply meditation. So a meditation that liberates one person, that same meditation might be used by the next person as a form of spiritual bypass, or to try to transcend their trauma instead of walk through their trauma and heal it. And so I think the truth is, feelings are stored in the body. And I don't think as human beings we do well when we suppress our feelings. I think feelings are a clue. They're given to us by the divine as a way to recognize when there's something that needs to be addressed in our lives. And sometimes I become concerned when some forms of spirituality or meditation urge us to shut down our feelings or bypass our feelings or to bypass our traumas. I think transcendence may feel better in the moment, but it doesn't heal the underlying issue. And so I just believe strongly, after studying these people with amazing recoveries for so many years, that we really do best when we find a way to have compassion for the hurt parts of ourselves, to have compassion for the hurt parts of others, and to seek to have curiosity towards those hurt parts, and find a way to heal them rather than transcend them or suppress them.
Yeah, very much important point.
Yeah.
Uh, how do you motivate patients who are not self-motivated enough for healing?
Great question. That's a great question. And I don't know that I have the best answer for that. But what I will say is that I think that we all long to be understood. We all long to be seen. And the more that we can create a compassionate environment where we have curiosity, I think sometimes when a person acts like they're not interested or even acts like they're lazy, I think the truth is they're often burdened more than lazy, or burdened and defended more than just simply resistant. And so I think a compassionate sort of curiosity, where we see what's right and special about each human being, because I think all of us struggle. We need others to help remind us and help us see what's right and special and unique and unrepeatable about each one of us. And having that kind of uh, ability requires us to do work on ourselves, because I don't think we can give to another what we have not first given to ourselves. We have to have that same compassion for ourselves. And when we are able to experience a true unconditional love for ourselves and all of our hurt parts, and accept the parts of us that we don't want to see or that we defend ourselves from seeing, and we work with those parts, when we do that kind of personal work on ourselves, um, and that puts a light back in our own eyes, then we have something that we can then share with others. And it's more caught than taught. It's not something that's done quickly or easily without a lot of real work on ourselves. So I think, again, we can't give to another what we have not given to ourselves. And so many of us are doing everything to help others, and we're not doing what we need for our own well-being. And I think that ultimately limits what we're able to give others.
Hmm. One question is how to look at symptom as message from the body for the course appropriate course correction.
Yeah, that's so great. I think too often we are taught to just eliminate the symptoms, which in many ways, if you have a red light that goes on in your car dashboard, we don't want to just clip the wire, right? We want to investigate what is the problem in the car. I think we often take better care of our cars than we do of our own nervous systems. And so if we can just begin to ask good questions with our patients and ask, is this a message about something in our lives that's out of whack or out of harmony? Is this a message that our body is compassionately trying to give us that needs to be addressed? And focus less on eliminating the symptom and more on understanding what this might be suggesting. It's a good question.
One question is from Dr. Vinita Singh. How does a nutrition affect feeling of spirituality?
How does nutrition affect this feeling of spirituality?
Yeah.
Yeah, I mean, I think we are what we eat in some ways, but at the same time, I mean, I think big truths, sometimes the opposite truth is also true. And so I've seen some people who did not change their nutrition, and I make the joke that I think they could have eaten cat food and still gotten better, because they did such work, deep work in healing their identity. So some people don't change the nutrition and still get better, but it's also true that nutrition is such an important part of lowering inflammation in our body, which I mean, depression and anxiety are made more severe by inflammation, for example. And so when we are healing the inflammation with nutrition, that can play a role in also improving our mood, improving our vitality, and therefore improving our spirituality, because our spirituality is the light in our eyes. It's the vital life force that we bring to ourselves and those we care about.
So, uh, um, most of the question have been covered. Dear friends, if you have any question, feel free to ask. You can ask any question. Meanwhile, I will just share the website of Dr. Jeff. Those who are interested can read the book, and it is a very wonderful book. And there are a lot of content on his website, drjeffreyrediger.com. You can go on blog, you can read many things. It is a big website. And this book is available on Amazon and other platform. So, first I ordered ebook, and then I got so much fascinated that I got physical copy to read properly.
Mm.
Mm.
It's in something like 23 languages too. So I don't know what languages might be
Yeah,
useful.
yeah.
Fine to look it up.
In India, in English and in Marathi, it is available.
Okay.
Yeah,
All right.
one of the regional language of India. But I am in Hindi belt. In Hindi, it is not available as of now. But
Okay.
it's okay. Once English is available, then I can read. But yeah, if Hindi is available, then it will reach to more number of people. And in author's note, you have mentioned Department of Bioinformatics at Harvard in 2018. The work of Dr. Isaac Samuel Cohen regarding this exceptional responder network. So this helped in your research. So will you share something on this?
Yeah, and I've talked to many physicians in the East who have seen many of these, because you have a long tradition of healing, and
Yeah.
so there's a lot that we could do by studying what you all have learned also before you went to medical school.
After TEDx talk, you have mentioned in East, they work on energy energy system, but
Yeah.
you have not went in deep on that topic. Although in India and in Asia we work on the energy, although it is not accepted in mainstream as of now.
Right.
But what you will say on this topic, that balancing the energy?
Well, there's so much there to understand, and I don't fully understand myself. There's different ways to talk about this, right? I mean, we are in the early stages of a transition from Newtonian and Cartesian science to a more quantum science world. And quantum science is not a theory, it's an indubitable fact that's been proven thousands of times now and has been something out there for over 80 years now. So, but I think the implications are so massive that we don't know how to step into that world yet very easily. And there's lots of opinions about what it really means. That I talked to Henry Stapp. He was a famous physicist at Berkeley. And I also had a friend who I interviewed for Cured, Andreas Mershon, who's at MIT, the Media Lab. He's a physicist there. And so I've tried to understand the ways in which these highly regarded physicists think about some of the popular talk about quantum physics that's out there in the culture. And they have some strong disagreements with the way it's popularly understood, but they also do believe that there's massive implications for how we think about the roles of belief in health and well-being. So it's a big topic. And the truth is, we simply don't know how to talk about energy very well. We can sense the energy that a person brings into the room, but what's the relationship of that to the energy that quantum physics is talking about? It's a really, really massive topic that we don't understand very well. I think what's great is quantum physics is entering our world every day through Silicon Valley, through the world that's now becoming more digital, where we don't understand quantum physics, but we know the technology and the math works. And so it's creating all these new technologies that are slowly beginning to democratize medicine, to help us become the CEOs of our own health and well-being. We now have apps on our phones. We have sensors in the environment. We are increasingly able to take more responsibility for our health and well-being and our nervous systems and minds and bodies because of this digital world that's coming in. But we don't fully understand it. And I think that over the next long period of time, as the world becomes more digital, as we apply the math, it's going to continue changing our technologies and remodeling our understanding of the power of belief and identity and these other factors that we can take more and more responsibility for. So
In India,
it's on the
yeah,
it's on the trailhead of something really big and important to talk about energy healing. And I've seen amazing things and I don't understand it or how to talk about it even.
in India, we have traditionally the understanding of seven chakra system, but yeah, the evidence of those chakras are not available as of now, and so
Mm,
conclusive data is not available how to talk it academically.
mm,
But
right.
yes, in tradition, many people are working on through this chakra healing and energy healing, and it
Mm.
works.
That's we have a lot to learn from all that study.
And more questions have popped up. So, uh, what is your daily schedule to serve all four pillars? Uh,
What is my what to serve all four pillars?
Daily schedule to serve all those four pillars personally. It will be great
Oh,
motivation for us
no motivation for it.
to.
I mean, what I've seen people tell me over and over again is that the that these that illness is not just a disease. It is a message from our body and from our deeper authentic self. And it is a compassionate message to us. And if we can begin to open ourselves with compassionate curiosity, um, these investigations and efforts to ask deeper questions about our lives give us our authentic self back and give us a life truly worth living with connection with our authentic self, with those we care about, with genuine, more authentic connections. And there's a lot to that. That means, who is it? Brene Brown said something to the effect that the people with the most open hearts had the best boundaries. And I think that there's something to that, that there's a lot of development and personal maturity that has to develop in order for us to develop healthy, balanced, connected lives that are healthy inside and out. And it's a very meaningful journey when we can do that and have the curiosity and the compassion for ourselves to open her to such a path.
This question is still pending. What is your schedule? How you fulfill these all four pillars in your daily routine?
Oh, how I fulfill these four pillars for myself?
Yeah.
Yeah, that's a good question. I think it's certainly changed everything. Partly for me, I now recently moved from Boston. I love Boston, but now I'm living in California and I still have my Harvard appointment. But the nutrition is so much more available here, where there's a lot more fruits and vegetables and very fresh fruits and vegetables. That's one piece of things, but also a lot more nature. And so I'm now living in a much more nature surrounded world, which I think is allowing my nervous system to relax and be out of fight, flight, freeze, or fawn so much. And it is it's less doing and more being and more gratitude. And I'm slowly developing more practices that allow me to be in they allow me to be in a more ventral vagal position, for example, and with the production of more of those hormones that we were talking about, with the oxytocin, the dopamine, the serotonin, et cetera. So and I'm looking at the barriers or the blockages that I've had in my own life around preventing me from developing deeper, more authentic relationships. I'm actively seeking community now and more intimacy with a small group of people. I'm now becoming a volunteer fireman to give back to my community. We have a volunteer fire. There's a lot of fire risk out here. So finding ways to be connected to my community, finding ways to be truly more intimate with a small group of people that I care about, and to live more in nature, and to have gratitude for the people and the nature that I'm able to be surrounded by. That's my practice, those kinds of things.
So most of the relevant questions is, I think, over. Some questions I don't is suitable for this conversation. So I am ignoring few questions, but I have taken the most questions asked by our participants. And you have mentioned gratitude. So I pay gratitude for you, for your time, for coming on our platform. And I hope more people will understand that there is hope of spontaneous remission in every case. Just we need to understand all 4 pillars as much as possible, and we need to integrate by understanding them. And I got words what we are I am practicing for many years. I got words that how to explain through this book, through this literature, that concept of there are many concepts are there in this book. Everything cannot be described in this short session, that brief session, but like default mode network, DMN.
Yes, right.
Yeah, for that I do recommend meditation, and that this network should not be active, DMN. We end our session through meditation, but I would want you to shed some light on this DMN.
Yes, that's such a big topic. The default mode network is it's still being unpacked, the structures in the brain that are connected with this, the deep, sometimes subconscious ruminations that we have when we maybe obsess over something, or obsess about maybe we're not good enough, or maybe there's something about us that's not worthy, or is that is faulty. These kinds of things, this ruminative tendency that's plays a role in preventing us from moving forward into more vitality and a deeper experience of the value that every one of us brings into the world. And so that's something that is being examined with meditation a lot these days, and the ways in which meditation can liberate us from the ruminative obsessions or the false beliefs and of the DMN. So
yes,
relationship between the DMN and the ego, there's a lot that we could discuss about that, but it's a big topic.
Yeah.